Hi, I'm Matt. I'm the founder and one of the pharmacists here at National Custom Compounding. I wanted just to chat to you about bacterial vaginosis. It is obviously a very sensitive topic, so I want to be as respectful as I can and professional as I can as a pharmacist. It's something that we get a great deal of number of requests for in an average week at NCC. And I think that predominantly happens because it's one of those situations where it can cause someone a great amount of discomfort, and it is difficult to find a solution if traditional over-the-counter solutions fail. And also, sometimes you find that general types of antibiotics, prescriptions, those sort of things, even though they're normally sort of the first port of call, they may not provide the resolve or the solution that a patient requests. So that's what we at National Custom Compounding do. We can obviously make a great deal of medicines for patients that are in situations where a typical medicine may not have done what it needs for them. So what is BV? It's basically that balance of bacteria in the vagina that when it's not balanced properly, so when there's no homeostasis, the disruption can lead to discomfort, discharge. Other symptoms might include odor, and it's very it's a sensitive topic, like I said, to start with. So the goal really is to improve the microbiome, and traditionally antibiotics have been used by prescribers to treat it. Often the challenge with antibiotics, like you've probably seen, is that they're not specific enough to just kill the bacteria that's causing the problem. They could kill the good bacteria, which helps to maintain that homeostasis. So there are a few other natural or alternatives that could be considered by a patient to improve the conditions. And here in our compounding pharmacy, one of the big ones that we see regularly is a product called boric acid. It's in a pessary capsule form. Basically, what it's used as one of the most common compounded products. It's been around for a long, long time, and it's very safe. So the capsule and pessary is inserted, and that insertion means that the effect only works locally. What it does is it reduces the natural acidic environment, which means that the problem bacteria find it more difficult to grow. It does have antifungal, slightly antibacterial properties, and because of its safety, it's been around for a long time. It's generally well tolerated. So obviously one of the things to overcome is just being familiar with how to insert the pessary. Normally it's used at night time so that it works overnight. Otherwise, using it in the morning can disrupt its effect in the local area. There are other options. There are some companies out there that produce probiotics specifically for this type of imbalance, and they can definitely help to repopulate the healthy bacteria in the vagina, which also helps to keep that homeostasis and return it to its normal way. Can be used orally or can be used intravaginally. And then there's other options too, like lifestyle tweaks. So this might include the type of clothing, so breathability versus synthetic. It also could be other medications that someone might be taking could be causing a discomfort and a disruption. So really, I just wanted to bring it back together just to share that compounding pharmacies like ourselves are very highly skilled in being able to put together formulations like this one, which may not exist in mainstream medicine and mainstream pharmacy, to give a patient a benefit that they really, really need. So just to wrap things up, BV can be very uncomfortable, frustrating in many cases. So with the right advice and a bit of personalized therapy, speak to your GP. We can certainly be a pharmacy there to assist you along the way. So obviously, boric acid is prescription-only medicine. You do need to talk to your doctor about using it. You will need to present a script to a compounding pharmacy. But if you've got any questions, feel free to reach out to our team. Otherwise, I hope this was informative and helpful. Thanks so much.